So this video is massage. This is the common massage techniques that you'll be assessed on in your exams. So the first one that we're doing here is just gentle light stroking. So as you can see, this is just introducing the dog to your touch and getting them used to you placing hands on them. So it's extremely light. What also we're doing here is just doing a generalised bit of bonding with the dog, and as you can see, she's enjoying her stroking. So really nice and light, there's no intent with it, it's just getting her used to being touched. So it's the first stroke that we do when we first start massaging. And you may have to take a few minutes to do this to get the dog to relax. Also note we've got the dog on a padded bed so that she's nice and comfortable. You can't expect the dog to relax if it's on a hard surface. So the next massage technique that we're going to look at is effleurage. So with this one, you're going in with a little bit more intent with the dog, okay? So you're putting a little bit more pressure on. Notice how Helen is going with the coat. So for the purposes of performing massage as a warming exercise prior to more deeper massage, you would go with the coat, okay? So you're doing a few light strokes. Also, you can see that Helen always has one hand on contact with the dog, okay? This is how we would expect you to warm up a dog for an exam. If you had some distal limb swelling, so if you had a swollen limb post-surgery, this is where actually your direction changes. So you actually stroke up the limb towards the heart. So you actually go against the coat direction, but it's to encourage lymphatic drainage and the fluid to go back up towards the heart. So this would be to disperse any edema. So the next one that you've got on your list of massage techniques is ringing, okay? So for this I'm going to come around the other side of the dog so you can see the technique. So as one hand goes forward, the other hand goes in the opposite direction. So we commonly use this massage technique on large surface areas of muscle, so on the thoracic region or the paraspinal muscles, but you do need to be cautious with this type of massage technique if they're very, very tight, as it can be quite unpleasant. You're getting a degree of myofascial release as well with this one, as you're getting the skin surface to remove relative to the muscles. So just coming backwards and forwards. So the next massage technique that you've got on your list is skin rolling. So this is commonly performed on the paraspinal muscles going cranially, and as you can see, the hand has picked up a piece of skin, is basically rolling it caudal to cranial. She hasn't dropped the skin roll, she's picked up and kept it. So you keep your thumbs fixed and the movement comes from your hands. So she's basically walking the skin roll up the dog. So I call this the incy wincy spider technique because it looks like a spider walking up the dog's back, and that's how it should look. So your next massage technique that you've got on your list is compressions. So this is where you use either the tips of your fingers on really small areas, or you can use the palms of your hands maybe in a larger dog. So here Helen is applying the palm onto the paravertebral spinal muscles. So what she's doing is applying gentle pressure onto the tissue, and then you hold it for about 30 seconds to get an ischemic response. So this is where the blood should be pushed out of the tissues, and then as Helen's holding it, in a minute when she releases it, you're going to get a rush of new nutrients and blood flow into the area. So it's very good if you've got areas of tight tension or areas where you think you've got decreased blood flow within muscles. Then Helen's going to show you where she does it with a single finger. So this technique is really good for sort of like trigger point therapy. So Helen's going to apply pressure onto an area here in the hamstrings with her finger. Hold the compression. And then, as we said, you'd hold it for 30 seconds and then release off. With all these massage techniques, before you go into the next massage technique, you should always perform effleurage to help flush out any toxins and flush in nutrients to the area before you move on to the next massage technique. So the next one that we've got is friction. So with this one, you need to be really, really careful because it can be quite sore in dogs. So as you can see, Helen's here is putting one finger down her index finger, and then the other finger should rest on top of her index finger. And what she's doing is going against the fibres. So here she's cross fibre friction in the triceps. If the dog is really painful, we recommend that you use ice first to sort of numb the area before then applying the cross fibre friction, and then again afterwards, as it can be quite an unpleasant feeling if you really are pushing hard to break down adhesions. So the next set of massage techniques that we've got are more percussive ones. So the first one that we're going to use is cupping. So this is where you cup your hand like you've got a bottle of water in it, and if you can hear here, as Helen's doing it over the chest, it's quite a hollow sound, okay? We do use this a lot for recumbent dogs. If they've got fluid on their chest, we'll use it to break down the fluid and encourage the fluid to come off the chest and out the front, obviously for the dog to cough up the extra fluid. The next one on the sheet is hacking. So this is basically where you look like you're performing a hacking motion on the dog. And again, Helen's just hacking along the dog's back. These are more stimulating massage techniques, and some dogs don't tolerate these very well because of the sort of the fast, repetitive nature of them. They find a bit alarming. And then the next one that you've got is clapping. So this is where you just use the flats of your hands, and then you're just literally just clapping the dog. And again, Helen's just going to finish off with some effleurage. That's good practice. So with effleurage, you should use 5 to 10 minutes before massage, and then 5 to 10 minutes at the end of massage. And that concludes your massage video.